I'm Dr. Caroline Abercrombie, our Senior Director of Experiential Learning here at ETSU Quillen College of Medicine. So really the goal was finding ways to help instill best practices in our simulation education, but also making us work together a little bit more and in a more structured way. We've really truly expanded our simulation not only for medical education, but across all health science programs, and that took a lot of administrative oversight. We are central in the interprofessional education program, which all 5 health sciences take a part in. You know, I'm really proud of our communications program because I do hear a lot from our graduates, our faculty, and residents here in the area that you could spot a Quillen student very easily because they're such strong communicators, and we have programs where they grab Quillen students. They're like, come teach these other residents how to communicate. But really just the students' excitement when they see the clinical utility of what they've been studying in a book or studying in a lecture hall, and then they actually get to go in and role play in the role that they've been aspiring towards being in for so long, for some of them since they were a child. So they actually get to truly play doctor and feel like they're playing doctor in here. And it's a safe place to make some risk and try new things, and that's what's cool about simulation. The patient's safe because the patient is simulated, especially in here. So we can hide in the back and make this as real as possible and give all the stressors of the real clinical environment without a real patient, without real family members in the room. We can bring in those standardized patients to even train them how to deal with the family members. So it's a real unique experience to get them outside of their comfort zone and help them reflect on ways they are going to address these real clinical situations. So I'm on a lot of boards outside of here. Nonprofits are very important to me. I love being engaged within the community. So within interprofessional education, I'm actually our Director of Community Engagement because of what I had done in the community already. And the Crumley House is very close to my heart. I do a lot of their fundraising, but also just being a part of a downtown because I grew up in a small town and I went to a College of Medicine that had a very similar mission as ours, rural and underserved. And I like to just create opportunities for families to get out into our downtown community and learn about things like art. So I actually am on the Blue Plum board, and I directed the Blue Plum Festival last couple of years. But as I've been here, I think our university's done a really good job of rebranding ourselves and making us feel as a united university, which I think is really hard when you have 2 different campuses. I think that's why we started out kind of feeling a little separate. And so it's just really cool to be proud of being a Buck and to go to a football game and go to a basketball game or a tennis match and have all these opportunities. I've just really kind of jumped into all of our athletics departments and our art programs in the Martin Center. And it's really made me proud to be part of ETSU. And so I think just, being a part of that community that ETSU's grown to create, especially over the past few years.